Hi everybody, my name is Dr. Mona Lisa Muchatuta. I'm an emergency medicine doctor in New York City. I'm making this video with my colleagues here in New York to try to help you understand how serious COVID-19 is, to encourage you to stay safe, to stay home, and to kind of give you a better idea of what's going on in New York City, just so you can really take this seriously. Hospitals are running out of medications. Some hospitals don't have protective gear for staff or family members or patients that come to the hospital. We're running out of medications, we're running out of equipment, and we're even running out of oxygen, which is something that patients that have COVID-19 need. So we don't want to test your immune system in this day and age. If you're feeling unwell, stay home. If you're exposed to somebody, stay home. I have a couple of colleagues that want to say some important words to you. Please heed what they have to say. This is Dr. Ravi.
Yes, a lot of people are only showing mild symptoms with this, and they're going out with just mild symptoms. That's a problem with this disease because they're spreading it. And they may go out, they spread it to their parents, their grandparents, and people who are dying with this. And you can think of it as your lungs being filled with fluid, like you're drowning. And once you get to that point where you're drowning, you need a ventilator to stay alive, and we're running out of that equipment for people. And we don't know who's going to do well, who's not going to do well. It's like you hit a tipping point, you start drowning, and you do really poorly, and we're running out of equipment in the hospital. Nearly everybody coming to the emergency department has this, and we're getting completely overwhelmed.
Hello, my name is Dr. Benjamin Obasaki, and one of the points I just want to touch on with this disease is that there's a common misconception going around that it's only the elder people in our population that's being affected. This is simply untrue. Every day we are having people, younger adults, come in who have very little comorbidities or other illnesses going on, who are being seriously affected by this illness. Affected to the point to where they have to be put on a ventilator just to breathe.
Like the one that's beeping in the background.
Exactly. The one that's beeping in the background is a young patient who was presumably healthy before they came in. This is not something that's isolated to the old. Please hear this warning and do whatever necessary to prevent this from spreading.
All right, we love you. We want you to stay healthy. We also have Mr. Duncan, one of our nurses, that would like to say a few words to you as well.
I just want to say is that the other side of the coin is we have limited staff. The same staff that is working with much more people. And when you have all the patients coming in, we have to line them up one after the other, bed by bed, trying to intubate anywhere we possibly can to save people's lives. So that's why we're encouraging all the young people to take it seriously and self-isolate and stay with your family for now until we try to figure this thing out, because it is really killing a lot of people. Thank you.
All right, so from New York, this is Dr. Muchatuta, Dr. Ravi, and Dr. Obaseki saying stay healthy. Okay.